big story, right? Which is, of course, what's happening with the hospitals space. Now, a Supreme Court warning to the central government over non-implementation of standard rates for healthcare procedures has spooked the street. It spooked healthcare investors. Ekta is here with the details, the news, of course, and what's being made of it. Ekta, take it away.
Thanks for that. Well, the big piece of news which has disconcerted investors in the past 2 days is that the Supreme Court has directed the central government to set standard procedure rates. Now, they have ensured there should be a notification of standard rate for healthcare procedures within a month. Failing to do so, the Supreme Court will consider implementing standardized rates as prescribed by the Central Government Health Services or the CGHS. Now, remember that cash-paying patients basically pay substantially more than CGHS patients. Cash-paying patients are around 40 to 50% of private hospitals in India. And private hospitals are free to set procedure rates for cash-paying patients. So basically, there's no cap right now. Macquarie says that the CGHS rates are generally 40 to 50% lower than cash-paying patients. Viren Shetty of Narayana Health, who was talking to us earlier, said that it can range in terms of a difference anywhere between 20 to 60%. So that's the kind of rate difference that we're talking about. Now, what happens in the next 1 month, one will have to see. But Macquarie says that if in case there is a worst case scenario and there is a CGHS rate which is set for all procedures across private hospitals, then private hospitals' profits will drop significantly. Now, Viren Shetty was extremely vocal on this and said that it would be an Armageddon for private healthcare. There has to be a middle ground, and the middle ground is probably having price transparency, creating a study list of procedures. Rules do exist according to him, but they need to be enforced. Now, Macquarie says that they will be monitoring the government response in the next couple of days. Standardizing procedure rates is a mammoth task according to them. But the CGHS rates could probably act as a good reference point. According to them, both Apollo and Max have also in the recent past seen volume growth softening. So maybe those would be stocks to consider at this point in time in the context of this news. And other multi-speciality hospital stocks, which I spoke to a lot of analysts about, should be on your radar, especially those which have higher average revenue per occupied bed, which can go up to around 70,000 odd rupees as well. Now, Bino Pathirampul of Elara Security says that all the listed private hospitals are likely to be impacted in case there is any kind of change in rates. The analyst feedback that I picked up is that those with lower RPOPs, which are mainly regional plays, anywhere between 25 to 30,000 odd rupees, could be less likely impacted in case there's any kind of move in terms of standardization of rates. And hospitals with lower cash-paying patients, around 30%, 25%, would probably see lesser impact. Next couple of days will be important to watch in terms of a government response to this. But yes, as of now, it's definitely shaking sentiment.
So for those who don't know, CGHS basically is basically medical insurance provided by the government, by the central government, for its employees. I mean, while you're in service and after service, CGHS essentially is something that government employees use to avail of medical services. And of course, over the years, what has happened is CGHS services are now available. I mean, it was the list of hospitals where you could actually go and get a procedure done and let the CGHS sort of payment scheme kick in used to be limited. But now it actually is pretty wide, and most private hospitals, I mean, you could go anywhere, any of the private hospitals, and do this. Ekta, so basically, just to clarify, okay, I think Ekta is not there anymore, but I think what Ekta is essentially saying that the reference rate has to be CGHS. And of course, I mean, the rate, there's a big difference in terms of what CGHS sort of notifies as what it would pay for a certain procedure and what the private hospital, if you walk in with a medical insurance or otherwise, I mean, if you don't have, and if you're a cash patient, you'd end up paying. So this is pretty significant out there. But let's actually play out that soundbite from Narayana Health. And this is Viren Shetty.